Hello friends, welcome to another episode of my video lecture series on MIT. Today I am dealing with a very important topic. Most of you will surely be very much interested. That is the most burning question: how can we prove the MIT hypothesis and establish it finally as a legitimate theory of scientific homeopathy? This is a question especially research-oriented homeopaths very often asking me, and I know we are already too late to address this most vital task, obviously due to our limitations of material resources. As all of you know, MIT or molecular imprints therapeutics is a rational hypothesis trying to explain homeopathy in terms of modern scientific knowledge. As per this hypothesis, homeopathic potentization involves a process of molecular imprinting in water alcohol supramolecular matrix using drug molecules as templates, by which supramolecular nanocavities or molecular imprints bearing the three-dimensional spatial conformations of drug molecules in their negative orientation are produced. MIT says drugs potentized above Avogadro limit or 12C will be containing only these molecular imprints as their active principles, which can act as artificial binding pockets for the pathogenic molecules, deactivating them and producing a curative effect when applied as a therapeutic agent. According to scientific methodology, once a scientifically viable working hypothesis is proposed, the next step is framing of appropriate predictions, questions, and designing experiments, outcome of which will ultimately prove or disprove the hypothesis. It should also include questions and experiments that can verify the falsifiability of the hypothesis. In this episode, I am trying to frame a set of questions, experimental outcomes of which will ultimately prove or disprove MIT hypothesis. To begin with, each question listed below has to be taken separately and searched elaborately in existing research database to know whether any of these questions were already answered by previous researchers. Once such available research papers are identified and collected, we have to design our own experiments to find answers for the remaining unsettled questions. Overall, we have framed 11 questions on the basis of MIT hypothesis, which are discussed one by one below. Question number 1. First and foremost question to be taken up is whether post-Avogadro dilutions used in homeopathy really work as curative agents or not. This question is crucial as it will ultimately decide whether homeopathy should be considered seriously or not. All other questions become relevant only if the answer for this first question is positive and affirmative. Anecdotes and so-called clinical experience have no any value in scientific method. We will have to conduct some well-planned, well-organized and well-supervised double-blind random controlled trials to answer this question beyond any scope for controversies or confusions. RCTs will have to be conducted using disease-specific combinations to prove that post-Avogadro dilutions really work. We should realize that conventional types of disease-specific RCTs, as done in modern medicine, cannot be convincingly and successfully done using single drugs, as homeopathy uses different drugs for same disease in different persons according to totality of symptoms. Question number 2. Second question to be answered is whether post-Avogadro dilutions used in homeopathy work not only in living bodies but also on in vitro biological samples. This question is important as it will prove or disprove the MIT idea that potentized drugs act at molecular level in the body and the concept of classical homeopathy regarding dynamic actions and vital force are wrong. In vitro studies will have to be conducted using disease-specific combinations and collected biological samples to answer this question. If it is proved positively, the theory of classical homeopathy that potentized drugs act through nervous system and vital force will be proved wrong. If MIT hypothesis is correct, these in vitro studies should prove that post-Avogadro diluted homeopathic drugs can interfere in the in vitro interactions between biological molecules and pathogenic molecules. Already there are a lot of such in vitro studies conducted by various researchers that proved post-Avogadro dilutions act upon biological samples, and we have identified and collected such papers from various journals. Question number 3. Next question is whether post-Avogadro dilutions can interfere or prevent the normal interactions between biological molecules and their natural ligands. Answer to this question will decide the correctness or otherwise of MIT argument that post-Avogadro diluted drugs cannot produce any harmful effects in the body. It will also decide whether high dilution drugs can cause drug proving as classical homeopaths think. In vitro studies will have to be conducted to find answer to this question. If MIT is correct, these studies should prove that post-Avogadro dilutions cannot interfere or prevent the normal interactions between biological molecules and their natural ligands. Question number 4. Next question is whether post-Avogadro dilutions used in homeopathy can antidote the biological effects of crude or molecular forms of same drugs. This question is very important since it will prove or disprove the correctness of concepts of molecular imprints as active principles of potentized drugs capable of binding to molecules having complementary conformations. In vitro as well as in vivo studies will have to be conducted to answer this question. If MIT is correct, these studies should prove that post-Avogadro dilutions can antidote the biological effects of crude or molecular forms of same drugs. In this case also, a lot of studies have been already done by various scientists that provide answers to this question. We have identified and collected those papers from research archives and journals. Question number 5. Another question is whether the biological actions of post-Avogadro dilutions used in homeopathy are reverse or opposite to those of same drugs in molecular forms. This question is closely related to the earlier question and same experiments can answer both questions. But this question is very important as it is related with the concept of molecular imprints as nanostructures conformationally complementary to the template molecules used to prepare them, capable of antidoting each other's action. Answer this question will also have implications in understanding the meaning of drug proving and similia similibus curanter correctly. Question number 6. The next question we have to get answer is whether post-Avogadro dilutions used in homeopathy contain constituent molecules of original drug substances or not. If MIT hypothesis is correct, our experiment should prove that the molecular forms of original drug substances are not present in the post-Avogadro dilutions. Then only we can establish the active principles of post-Avogadro diluted drugs are molecular imprints, not drug molecules. To be reliable, these studies should be done using samples potentized under direct supervision of researchers, as commercial samples available in market may not be genuine in most cases. While working upon this question, we should be careful not be led to wrong conclusions by the probable detection of random foreign particles that may be present due to the contaminants in water and ethyl alcohol used for potentization. We should be capable of differentiating such foreign particles from the original drug molecules. Question number 7. Next question we have to get answer is whether the chemical structure and chemical properties of post-Avogadro dilutions and unpotentized water alcohol mixture are similar or not. If MIT hypothesis is right, they should be similar, as both of them will contain only water and ethyl alcohol molecules, and chemical properties will be similar. It will prove the correctness of MIT concept of molecular imprints as supramolecular clusters of water and ethyl alcohol. Question number 8. Now comes one of the most important questions in proving MIT hypothesis. This question is whether post-Avogadro dilutions used in homeopathy differ from unpotentized water alcohol mixture regarding their physical properties. Studies will have to be done to verify whether the post-Avogadro dilutions differ from unpotentized water alcohol mixture regarding their physical properties such as evaporation rate, surface tension, viscosity, freezing points, boiling points, Brownian motion, refraction of light, etc. If MIT hypothesis of supramolecular rearrangement of water alcohol molecules is correct, these studies should prove that post-Avogadro dilutions differ from unpotentized water alcohol mixture regarding their physical properties such as evaporation rate, surface tension, viscosity, freezing points, boiling points, Brownian motion, refraction of light, etc. Question number 9. Obviously, the next question is whether post-Avogadro dilutions differ from unpotentized water alcohol mixture regarding their supramolecular arrangements. Complex advanced spectroscopic studies will have to be done to find an answer to this question. If MIT hypothesis is correct, these studies should prove post-Avogadro dilutions differ from unpotentized water alcohol mixture regarding their supramolecular arrangements. Already there are a lot of studies done and papers published by many scientists on different parts of the world on this question, which will be helpful in our work. Question number 10. Another question is whether supramolecular arrangements of post-Avogadro dilutions used in homeopathy could be changed or reversed to that of unpotentized water alcohol mixture by subjecting them to strong heat, electric currents or other forms of electromagnetic energy. if MIT hypothesis of molecular imprints as supramolecular clusters is correct, these studies should prove that supramolecular arrangements of post-Avogadro dilutions could be reversed to that of unpotentized water alcohol mixture by subjecting them to strong heat, electric currents, or other forms of electromagnetic energy. Question number 11. Final but most important question is whether water is a substance with polymer properties so that it could be used as a medium for molecular imprinting. One of the main criticisms against MIT hypothesis was that molecular imprint could be done only in polymers, and since water is not a polymer, molecular imprinting could not be done in water alcohol matrix. Even though I had scientifically explained why water is considered a polymer-like substance, many people were reluctant to accept my explanations. Now comes a great research work that has scientifically proved that liquid water is a dynamic polydisperse branched polymer. This work done by a team led by William Goddard and Saber Nasserifier is a great breakthrough in water research, which will of course be a decisive help in establishing the concept of molecular imprinting involved in homeopathic potentization as hypothesized by MIT. According to the researchers, they have proved through quantum mechanics force field molecular simulations that liquid water is a dynamic polydisperse branched polymer. They have showed that when ice undergoes melting, the number of strong hydrogen bonds drops quickly to 2 in liquid water. These 2 strong hydrogen bonds couple into chains containing over 150 water molecules resembling a branched polymer, where polymer branches evolve dynamically. Others expect that this dynamic branched polymer paradigm may explain long-standing puzzles of water and may explain the observed angular correlations in water. A lot of further research projects have to be designed and executed to prove or disprove the above points so that MIT hypothesis could be finally accepted or discarded. My earnest request to young generation of homeopaths is to take up these projects and work upon them if you want to make homeopathy a scientific medical system and get accepted as such by the scientific community. Outcomes and conclusions we arrive at from these studies based on the questions listed above will certainly help us in proving whether MIT hypothesis regarding homeopathy is scientifically right or not. Since these studies are of much importance, we need to mobilize a lot of institutional, financial, technical, human resources, administrative and scientific supports for executing them in a perfect way. Thanks for listening. We'll come back with another video on another aspect of MIT very shortly. Goodbye.